So, Minister, so this is the thing as well. So whilst we have made some investments, some improvements, but when you go down, especially with the free healthcare, this was supposed to at least balance the scale a bit for bring up those vulnerable and very poor families, let give them that quality, but still there's something missing.
Yeah. So I think it's a very important thing. Maybe I'll just need to clarify a little bit with the doctor. Where I start with access, I look at the minimum essential requirement for access. So that approach is not through primary health care. But that's not the only approach. We've invested so much in primary health care. Complementary to that is secondary and tertiary care. Unfortunately, we haven't invested so much in that over the past few years. Our priority now is to reinvest, not to reduce our investment in, not for reduce the investment we don't make in primary health care, but now for complement that and invest a lot more in secondary and tertiary care. We're critical because what can happen, you want to minimize the burden on secondary and tertiary care by having a very, very effective primary health care. You know, if you get good primary health care, the number of people that we need for secondary and tertiary care is reduced considerably. So what you would do now for rebalance and invest a lot more heavily in the secondary care for complement with that investment in the primary care. In terms of access, in terms of funding, the free health care is directed at the most vulnerable of the population, pregnant and lactating mothers, infants, people that will recover from Ebola. You know, I think a small segment, and I think so too. They try to give them the maximum amount of support for being the most vulnerable. What's happen now? You get a population. We not fill that group. We're not to lactating mother, not to pregnant woman, not to baby. You know, how you to provide care for them. You know, most of them are out of pocket. And out of pocket, they account for about 54–56% of healthcare delivery. What you want to do now for supplement that by pooling risk, where you pool risk through a health insurance system, so we get slushy. Slushy when we take off in the next few months, hopefully. It create a safety net where you pool the risk and make sure so not 100 people and they get motorcycle accident every day. But if there are 100 people, then put small money towards. If one pandemic get an accident, you're able to get enough resources for manager. So we did try for raise more money that way.
And why should we talk about more money, even with free healthcare system? Inside the manifesto, there is this talk about expanding the free healthcare system for include all school, picking them as well. So, I mean, give or take, you'll be probably adding 2 million people to the system. So, enormous resources as well. So, how now one foresource those fundings?
So you get a choice. You get a choice. Either you invest in primary health care for prevent illness in young people then, or you wait for seeing a secondary and tertiary hospital with much more expensive. So even as we look at expanding healthcare, particularly with school-age kids, we primary motive now for make sure say where you do school, you focus on learning. With all this investment in quality education, you focus on your learning. You're not able to focus on learning if you get malaria. You're not able to focus on learning if you eye the art, you're not able to see properly. You're not able to focus on learning if you use the art, you're not able to fine. So we want to ensure so you get healthcare delivery as an important package of the school system, school health. So I think so not a new concept that we've all been small in the 60s and 70s. I don't want to reveal my age now, so but we've been get good healthcare. So I not say the cost will expand, but with a combination of investment from the education sector and investment from the health sector, we begin come together, and if you get an insurance scheme where they pull resources, where the government contribute to, you go begin raising of funds for able to expand the services.